Yeah, I mean, any plan that falls short of single-payer healthcare is guaranteed to fail. Oh, hey, didn't see you there behind that Yeti. I'm Josh Crowley, but you knew that already. You caught me at a good time. I was just talking to myself out loud about healthcare. Care to join me? Where was I? Oh, right. Every plan that falls short of single-payer healthcare is guaranteed to fail. Why? Well, because they'll be expensive, and more importantly, they won't actually change anything for most people. Discourse tends to focus on the uninsured, but that's only the very tip of this iceberg of shit we call a healthcare system. Shitberg? Even with good private insurance plans, people still end up broke or bankrupt. Claims get rejected. Reimbursement becomes a full-time job for people who are often in the middles of devastating illnesses or injuries. Different providers are in different networks, and there's no guarantee that if you go to an ER, the doctors take the same insurance as a hospital. How is that even a thing that can happen? The reality is that nobody in America has good insurance. If you think you do, you've probably never had to deal with redeeming it, never had to spend dozens of hours on the phone just to get the product you've been paying for. Like the woman whose story I've linked in the description who lost her child in an accident and had to spend months fighting hospitals and her insurance company during the time she should have been grieving. And then there's all this talk about choice. When was the last time you chose which health insurance provider you had? If you're like most people, your job had a few options for premiums and deductibles from the same provider, and you picked the one you thought would screw you over the least. Even at the same job, your insurance can change if your company decides to go with something different or gets bought by a different company. So where's all this choice we keep hearing about? How stupid do they think we are? We already have a public option through the Affordable Care Act, foisted upon the uninsured with some bullshit penalty if you don't have any coverage. Well, Obamacare did implement a few pretty significant regulatory changes, like, for instance, preventing private insurers from disqualifying people who have pre-existing conditions, which is admittedly huge. It didn't really do much for anyone who already had private insurance. And neither will any new public option or revision of the Affordable Care Act. If the ACA was actually that effective, we wouldn't still have people rationing insulin, and we wouldn't still have healthcare costs that dwarf those of other countries that have single-payer healthcare systems. For individuals, the average yearly premium cost is something around $7,200, and for families it's around $20,600. Most of that comes out of our paychecks before we even get them, so we really don't think too much about how much it costs. It's often largely subsidized by our employers, so you might be paying, say, $1,200 and your employer pays $5,000, but really you're the one paying all of it. What I mean is, if you make, say, $50,000 and then you and your employer pay $7,200 for health insurance, you actually make $57,200, but 14.4% of that is taken for health insurance. It's just presented like some sort of confusing shell game to deliberately confuse you. And then there are deductibles. Deductibles are the amount you have to pay out of pocket before you even get to use your insurance. Imagine if you had to pay $100 a month for a grocery subscription, but then you had to buy all the groceries at full price until you spent $2,500, at which point everything you bought after that was discounted 80%. If that sounds like a stupid analogy, it's because what it's representing is stupid. The average deductible is just over $4,300 for individuals and just over $8,300 for families. So you could spend $11,500 on private insurance and healthcare before you even see a dime of coverage from your insurance. And there are separate in-network and out-of-network deductibles, and they often aren't shared. So if your in-network deductible is $3,000 and your out-of-network deductible is $6,000, you might end up paying $9,000 out of pocket before you can even redeem any of the insurance that you've spent $7,200 in premiums that year to have. And even then, you're still on the hook for like 10% or 30% of the cost beyond that. And even then, deductibles reset each year, so if you get cancer in December, you'll have to pay $4,300 before your insurance kicks in, and then in January, you'll have to pay another $4,300 before it kicks in again. Obamacare didn't change that. Another public option won't change that. Medicare for all who want it won't change that. But a comprehensive system like Medicare for All will. Every human being in the United States will have a plan that covers all their healthcare needs. You won't have to spend $4,300 before you can even use it, on top of the $7,200 in premiums. You won't have to worry about whether or not your ailment or disease or injury is covered. You won't have to guess what the prices might be because nobody can give you a straight answer beforehand. You won't have to try to figure out whether the ER takes the same insurance as a hospital, takes the same insurance as a surgeon, takes the same insurance as a testing lab. You won't have to worry about your doctor suddenly being out of network if you change jobs or if your job changes its insurance provider. You won't have to worry about providers being in-network or out-of-network at all. You won't have to spend union meetings trying to negotiate for healthcare plans. You won't have to spend hundreds or thousands of dollars to continue your coverage through COBRA if you get laid off from your job. You won't have to go bankrupt. You won't have to spend hours or days fighting with people determined to screw you over when you're already sick or hurt or you've lost someone you love. And that won't just be for a handful of people on some optional public plan only available to those presently uninsured. That'll be for everyone. Part of the reason it's so hard to dismantle universal social programs is because we all pay into them and we all benefit in return. The ACA is already getting picked apart, and it's less than a decade old, but every time someone suggests we privatize the post office or get rid of libraries or Social Security, there's public outrage. It's a sad fact that empathy is a scarcity in American culture, which is why systems paid for by the public that help only those with the most need are constantly under attack, just like Jesus would have done. Nobody's going to... Hold on. Sponsors. Sorry, this will only take a second.
Buy human hair!
Nobody's going to defend a system they themselves don't get anything out of. Warren's public option plan would tax the wealthy to cover its costs, which is all good and well, and I'm totally in favor of that, but it plays right into conservative talking points like, why should I have to pay for somebody else? It also draws up the whole plan in opposition to the most powerful class in America, who will do everything in their power to dismantle it. And unlike Sanders' plan, it actually increases the collective healthcare costs for our country. This may sound counterintuitive, but half measures like additional public options are actually more expensive than comprehensive systems. One of the biggest selling points of Bernie's plan to implement Medicare for all is that it will actually save us all money, both collectively and individually. If the point of the system is healthcare rather than profits, we can cut out a lot of the cost right off the bat. I'll have a video soon on the corrosive effects of profit motives, so hit that subscribe button. We'll also save a lot of money by eliminating all the bureaucratic mechanisms engineered to keep people from actually using their insurance. Think about it. When you pay your private insurance premiums, part of that money goes toward paying a team of people to figure out ways to make sure your claims get rejected. But some of the biggest savings versus other plans come in large part because of the statistical models for projecting and distributing risk. With any insurance system, you're banking that for the most part, in any given year, most participants won't need to use it. Which means that, well, most people are paying for something they aren't actually getting. Which is fine, because the product isn't cancer treatment, it's being able to get cancer treatment if you need to. You're paying for a safety net, hoping you won't fall off your tightrope. You need healthy people to pay for a service they might not redeem for years in order to offset the cost for the people who will. It works because nobody can predict the future. Yet. Yeah, right. We can't even accurately describe the past or present. Anyway, if your risk pool expands to 320 million people, the average cost per person is very small. Most people in a given year aren't going to need heart surgery or cancer treatment. One of Sanders' proposals for paying for Medicare for all involves a 4% income-based tax for most American households, with increased taxes on the very wealthy. Remember what I said before about someone making $57,200 per year and having 14.4 of that taken for health insurance? Or $70,600 if you've got family coverage, with about 29% of it taken for health insurance. And that's not including deductibles and co-pays and all that bullshit. 4% sure sounds a lot better than that, huh? Even if you're a family making, say, $200,000 per year, which is kind of a lot, right? Like 4 times as much as the median income, at most you'll be paying $8,000. And per Sanders' plan, any savings your job gets from not having to pay their share of your healthcare premiums will have to go toward your paychecks. So now your salary's $57,200 instead of $50,000, or $70,600 if you've been paying for a family plan. And yeah, that means you'll be paying $2,288 for the healthcare tax, so it's more like a $4,900 raise, but imagine what you can do with nearly $5,000 more dollars each year. Anyway, all of this is complicated, and there's a lot of math involved. But the long and short of it is that if you include everyone in one united program that they all pay for and you pool all their risks, it saves everyone a lot of money. To be fair, public option plans will help insure some more people who don't have access to healthcare at all right now, which is major. But if you've already got insurance, Medicare for all is the only system being proposed by a presidential candidate right now that'll benefit you. And, well, there's only one candidate proposing it. Anyway, if you enjoy my content, please subscribe and recommend it to your friends. If you hate it, please recommend it to your enemies. Thanks very much for watching. We all have precious limited moments in this world, and I appreciate that you chose to spend some with me. Until next time, be seeing you.